to wait just a few more minutes and we'll get started. Okay, I've got 3 after, so I'm going to go ahead and kind of get us started here, and then hopefully some more will join. So thank you all for coming. My name is Paige Maxwell. I am the Director of Youth Transition Programs for Able, South Carolina. We're a nonprofit that runs in the Midlands and the Upstate, and we are a Center for Independent Living, so we serve people with disabilities, and a majority of our organization is made up of people with disabilities. And so I came to this as someone that oversees programs that goes in and out of our middle and high schools in our serving area. And so part 2 of our event today for Reimagining program delivery to students during COVID-19. We're going to focus a little bit more on the school side and the organization side of things. Last week, we heard from Vicki Ladd and from some youth about the challenges of receiving services and being provided services that were traditionally offered in school, and what that new setting during this COVID-19 looks like for them, and considerations to keep engaging youth, hearing it from the youth. And if you missed that, it is on the Eat Smart, Move More South Carolina website, and I'm sure some other partners in this are sharing this as well. But today, like I said, we're focusing on those experts that are delivering those services, and the schools that are housing those and also delivering services to students. And so I am going to ask all panelists that we have to just start by sharing your name, the organization, your role, and where you're located, since we've got people kind of spread out over South Carolina. So I'm just going to go on who I see on my screen. So Tabitha, I see you, if you don't mind getting us started. You're muted.
There we go. Okay, good afternoon. Sorry about that. My name is Tabitha Strickland. I am an assistant principal in Kershaw County School District. I'm at North Central High School. I have also had a special education background. I was a special education teacher for about 9 years at the high school level, and then was a special education coordinator at the district level, and I also worked for about 5 years in the Office of Special Education Services at the Department of Education. So I kind of bring a holistic viewpoint or perspective or lens to service delivery. But right now my role is in the school, and I'm happy to be here. Thank you so much for the invitation.
Thank you. Amanda, do you mind going next?
Sure. Good afternoon. My name is Amanda Metzger, and I'm the Director of Community Engagement for Healthy Learners. And we are also a nonprofit organization, and we serve in 150 schools. We're in 5 program locations across the state. So we are in the Midlands and Columbia. We're in Greenwood, Allendale, Dillon, and Georgetown.
Awesome. Paige, a fellow Paige.
Yeah, that's kind of unusual, isn't it? 2 pages.
It is.
So my name's Paige Selking, and I'm the project director for Ending the Silence for NAMI, South Carolina. And we provide mental health education and suicide prevention and awareness to middle school students, high school students, school staff, and family members, so parents and caregivers, and as well as community members. So we go into churches as well. So basically anybody who supports youth is who we want to talk to. We're in every county now except for the PD region, and that opens up next summer. So we do have one coordinator in Florence, but with virtual, we can pretty much present anywhere right now.
Yeah, that's awesome. And Karina.
All right, good afternoon. My name is Karina Jones. I am currently the school social worker for Richland School District 1 at Eau Claire High School. I've been here maybe about 4 years. This is my 4th year. Prior to this, I did social work for the Department of Mental Health and South Carolina Department of, Mecklenburg County Department of DSS.
Great, thank you all. So I'm gonna start with a couple of questions that are pointed a little bit more towards school staff, but those of you that aren't school staff, if you want to weigh in, please do. And so first question is, what types of outside speakers, programs, or services do you typically provide at your school, and kind of what has that impact looked like with COVID-19, or how has that changed?
I'll go first as far as our school goes. And I mean, if you're familiar with how school districts are reopening, you've got some districts that are completely virtual. You've got some that are kind of doing a hybrid. You've got some that are phasing in different phases. Kershaw, I'm very fortunate that Kershaw County School District actually offered face-to-face from the start. Now, we did push back our start date to September 8th, but we did offer face-to-face. A clear message was that we would have no visitors, but that has not affected visitors that have been able to come in and provide services directly to our children. So if our children are here getting face-to-face instruction, we do have outside providers coming in providing services. So anywhere from guest speakers, for example, today we had someone from, I do believe he was from CERTA, come and talk to our teacher cadets. We have the Department of Mental Health that comes in and provides in-house services to some of their clients that they may be seeing in the community. We have a partnership with the Alpha Center that is also an outside facility that offers drug and alcohol abuse support as well as mental health support. So to some degree, I mean, we're very fortunate. I think where we, we actually, Able South Carolina and my school have started having dialogue and conversation about them coming in and providing some services to direct supports to teachers as well as to students. And that's something that we're working with right now And by the way, we've gotten green lights all the way, Paige. Just have to run it through because there's going to be some data collection. And I think that's sometimes where you kind of get, you'll have some barriers to maybe getting into schools, because if you are collecting data, which we're a data rich world these days, and who doesn't collect it, but it does cause a few, some more red tape that often has to be gone through and explained through. So, but yeah, for the most part, we've not had too many barriers getting people in that were already in. The big thing is they have to follow, our protocol. So they have to check in with the front office, get a fever check, hand sanitize their hands, wear a mask. So that's it in a nutshell on this side.
Okay, well, at Eau Claire, we've had several programs such as like group therapy programs. Well, I guess just to kind of start, like she said, Kershaw had a face-to-face option. Richland 1 is entirely virtual. And so all of our students are receiving their education virtually. And so some of the programs that we were providing prior to virtual learning were group therapy, one-to-one mentoring programs that were provided from inside the building as well as outside organizations that would come in. Just various things that you would have at all schools, like college and career fairs, mental health services, military recruitment, different ceremonies as recognition for our students, motivational speakers, educational field trips, and one specifically, our snack pack program, where we would have an outside agency that would sponsor our students to receive snack packs every Friday. And so I think, COVID and just everything going on has greatly affected our population. All the things that I just listed have not been able to happen. Obviously, the students are not here in the building. And so a lot of our programs have been greatly affected due to the virtual learning.
Yeah, and I know I've heard a bit about licensing for Karina. I'm thinking of your role, but and this is related a little bit more to special education population, but just licensing for some services and how that's been licensed to happen in person. And so there are some providers that are having to make sure that virtual is an option for them so that their licensing doesn't get changed or edited. So I know that Tabitha, like you said, with that red tape for data collection, there's that licensing piece also falls within that. It just takes a couple extra steps and things we hadn't thought about before. What do you think are some of the most critical outside services that students are needing right now? From anyone really? What are those services look like, and what do you think students are really needing?
I guess if I had to look at what we were offering our students, just all of them actually, but our students really need the mental health services. They really need someone, we had individuals from Columbia Area Mental Health that will be able to come in and do one-to-one counseling with our students. And, reaching them now in the homes is difficult when we're talking about just getting their education. So then to add additional services, and students are sitting in front of computers for 4 and 5 hours straight, and then requiring them, sorry, I'm in a school, so there's a school bell. Then requiring them to do some type of like telehealth or log in with and we're losing a lot of those kids that would normally participate in those services just because of the barrier and because of all the, different things that it's requiring of them because it's virtual. And so I think, mental health services is definitely something that's needed for our population and in schools in general. And then also something as simple as a snack pack program. The students really, I had a large population of students that would come to me every Friday for those bags. And so it's almost, close to impossible for me to drop off 40 to 50 bags every Friday to 40 to 50 different homes. And so trying to figure that out. And we lost actually our sponsor the program that was sponsoring our school and several other schools in Richland 1. And so, you know, that's just a major hit of trying to find that resource again for our population, and then try to bridge the gap of how we'll get those things to our families. And so those are just some of the things that were needed at our school.
And I think, you know, to expand on that, certainly the mental health side, but I think, you know, just healthcare in general for these kids right now. So many of the kids, especially in these rural communities, were receiving a lot of those services through the school and being identified through the school nurse and through their teachers. And I can talk about that a little bit when we talk about our program later, but I think that's just a huge thing that we need to be thinking about, how we provide access to just healthcare in general, mental, behavioral, but primary care and other services that those kids need right now.
Yep, I echo everything that Ms. Jones said, and Amanda. I mean, mental health counseling it didn't take me a half a second to write that down whenever I thought about this question, or because that just was at the top of the list. But whenever, as educators, when we think about helping our students, you know, progress academically or behaviorally or functionally, the first thing we have to address is their healthcare needs, their physical, their mental. We've got to make sure that that those are met before they can even get to instruction. And Amanda, you kind of hit the nail on the head. I'm in what I would consider a rural school, that we had a nurse practitioner that was here on site. We had a couple of mental health counselors that were here on site. We had, a nurse here, and we had a lot of supports that were here, just kind of built into the school and the community. And when we went out in March, as an administrator, I was scared for the students that weren't going to have that readily available. And now we still have them, and we still struggle. We have students that have chosen, and it was parent choice, to be virtual, but there's a few that I can think of that were, on that list of worry back in March, that for whatever decisions, have decided to be virtual again. And there is limitations to services being provided if they're at home. I have a student right now that I can think of that, we wanted to do a functional behavior assessment on, so we could really get to the function of the behavior, but the child's virtual, and doing a functional behavior assessment to get to the function of a behavior that was occurring at school, not at home. You need to have them in school to do it. So to me, and that's just one example, that it kind of just, it pushes a timeline back. It pushes, and to me, that's pushing back service delivery. Like when they can start getting intervention, or when they can get assistance and start moving in the right direction. But, basic Maslow's hierarchy of needs, like, physical, mental, get those taken care of, and then we can get to really targeting and helping students get to better academic and behavioral outcomes.
Yeah, I agree. I think that's what we see, a lot of people making big decisions around making sure that some of those base services are really available to students, or that the school was how they were accessing a lot of those services. All right, I'm going to switch gears to our nonprofit and our organizations on here with us, and just asking generally, what types of services are you typically providing in schools, and how have those changed with COVID-19?
Sure, I can go. So Healthy Learners, our mission is really to provide students with access to healthcare, so the healthcare that they need, so they can really thrive in the classroom. So just really echoing what everybody just said a few minutes ago. So we address health barriers to learning, things like dental, vision, hearing, asthma, mental and behavioral health. And so traditionally, we work with school nurses and teachers to identify the children that have unmet health needs, and then we coordinate that care and provide that access through transportation. So our staff picks up the child at school, takes them to that medical appointment, and then brings them back to school. for many working parents and low income families, taking time off of work to take a child to those appointments just is really simply not an option. And so, and in our rural counties, we worked really hard to do mass screenings and done some pilots with that in the school setting to identify children with vision and dental problems. And so that's certainly something that we're having to pivot this year, since mass screenings are definitely not something that's on the table at this time.
So our program, it deals with mental health and educating the students as well as the school staff and parents about mental health. And I just wanted to give a couple of statistics, because I know both Karina and Tabitha acknowledge that mental health is a huge issue right now for students. Obviously it always is, but now we're seeing it as an even greater need. I don't know if any of you have seen, but Harris Poll did a survey back in May for 4-H. And at that point, so that's, maybe 2 months in to them not being in school. And at that point, 70%, 7 out of 10 of the teens said that they were experiencing struggles with their mental health. 64% feel like this is going to have a lasting impact on the mental health of their generation. And 67% said they feel pressure to keep their feelings to themselves and pretend like they're not feeling poorly, mentally, so that they don't worry people. And 70% said that they wish that their school district taught them more about mental health and coping mechanisms. So I just wanted to kind of share that, because that's directly from the youth and what they're feeling surrounding mental health during this time, and what they feel is an important thing. 82% said they wish that the conversation about mental health was more open. And that's one of the things that we have seen as a result of COVID that's been kind of interesting, is the conversation has gotten more open, because so many people have struggled with stress and anxiety related to COVID-19 and just the uncertainties. And so that's something that we're hoping to kind of keep that conversation going and not have it kind of slide back into the background where nobody wants to talk about it. So our program is done by 2 presenters. We have 3 separate ones, so they're slightly different. All of them give mental health symptoms that someone might be struggling with some suicidal thoughts, and then how to get help. So like for the youth, we talk to them a lot about finding trusted adults in their life that they can go to when they're struggling. And when I talk to the whether it's school staff or parents, then the flip side of that is we need to be trusted adults. So what does that mean? Not blowing off youth when they come and say, I'm feeling stressed out or depressed or whatever. And so many youth say, yeah, they tell me, what do you have to be depressed about? You don't have bills or this or that. So it's really important for us to share with the adults too, how we can help our youth with their mental health. And so we talk about that as well. All 3 of our programs are presented by 2 presenters. The lead either lives with a mental health condition themselves or is the family member of someone who does. And then we always have a young adult that comes in and shares their story, because we always want to let people know there's hope. So if you get into treatment, then you can lead a very successful life and, manage your mental health symptoms. So that's something that's a little bit unique for us, is that everyone that is participating in the program has lived experience. So we can bring not only statistics and facts in, but we can also bring personal examples in, and that tends to be very helpful for people. So that's kind of what we do.
Awesome. And Paige, our work is very similar. My staff are young adults with disabilities going into special education classrooms and teaching young adults with disabilities about their disability, and mental health is certainly a piece of that, and a disability within that. So I love that peer connection. I think that's really important. So what I would ask of you then is, these settings where you're typically in schools or you're working with schools closely, and maybe, Richland 1, that's not an option. Some of our other school counties, that's not an option. So what have you done to pivot some of your program delivery to make it accessible or to reach some of these students, especially when you can't be in the building right now?
So for us, when school's closed, all of our presentations are typically done in person. So we spent, a month probably on a mad dash to learn Zoom. I think everyone was in the same boat, trying to figure out how to kind of move everything into a virtual realm. We didn't present to students because one of our concerns was safety for students who were home, and we had no way of knowing whether or not they had any adult present if they were starting to have some struggles during the presentation. So we really focused on particularly parents, because parents were home with their kids 24/7 for months on end, and they were the ones that really at that point needed the information the most, because they were the ones with their eyes on the kids. So we wanted to make sure they had that education that they needed. When we discovered that school was not going to look the traditional way when they came back in the fall, we realized that we needed to figure out a way to present to students regardless of whether they were home. So this last probably 2 months or so, we've really been working hard to try to figure out a way to go ahead and continue to do our program, not just for the school staff and parents, but also to get back to talking to students. So we actually have come up with a way to present virtually to the students who are sitting in the classroom. So those that are doing, hybrid face-to-face. And we've also come up with a protocol to allow us to also present to the students who are virtual. And that was something that we worked out. We kind of put together a plan and then ran it past some of the school counselors and some of the different districts to see if they thought it was workable. And we've now successfully done that with several different schools, presented to their virtual students, and actually it's gone super well. I don't know if you want me to tell you now or if that's a question later of how we ended up going about that, because obviously safety is a concern for us, but also for the school. And so what we ended up doing was we always have a breakout room set up, whether it were Zoom or Google Meet or Microsoft Teams, I guess, is just now getting breakout rooms, but it sounds like that's going to be a possibility as well. And then we always make sure that one of the school counselors is standing by in that breakout room. So if we have a student who is in the presentation and starting to, feel some struggles and about what they're hearing, and then they can go ahead and just jump straight into that breakout room and talk directly to a school counselor. And then we always make sure that that school counselor's contact information is in the chat box. We put it regularly in the chat box, the crisis text line, the hotline, just lots of resources for them to be able to reach out. But like I said, we've done it, I think, 2 school districts, but a total of 4 schools that have virtual students. And we know of at least 2 of those where we did have students during the presentation that went into a breakout room and were able to talk to a counselor. So we knew it worked because, it not just in theory, but it actually did work. But it was amazing to see the engagement that we've had from students during the chat, in the chat box, maybe because they're so comfortable with texting and chatting instead of talking. So I was in one, and I kid you not, there was like 29 students, and we probably lost count at more than 500 messages in the chat box. They were just asking questions, they were encouraging each other, discussing what the topic was. So it was very exciting to see that we had a way that we could, reach out, particularly to those students who are not getting that interaction and not having that ability to walk down the hallway to the school counselor and let them know that there was maybe an issue. So that's what we're doing right now is just figured out a way to move it all to a virtual format.
Yeah, and I'll say we did some programming with youth over the summer, and this does not faze them one bit. And like you said, all the chat box and encouraging each other, and it's just like a whole nother world in that they're so comfortable with. And I end up having to I struggle to switch back and forth and pay attention, and it's just like it's second nature to them. So I feel like youth are they're not as fazed by this as we are, but I think that's a good thing. But Amanda, I know you were talking a little bit about some of those mass screenings and transportation and things like that. So what of your services, what have you done to change those services, or what do they look like now?
Yeah, so like I shared before, typically, we would try to be really efficient. We might go to a school and pick up 5 kids and take them all to the dentist at the same time. And obviously, in the light of COVID-19, we've had to implement physical distancing guidelines that obviously no longer allow us to transport children in the same way. And so we've really had to think about the best way and the most efficient way that we can deal with that right now. And so since we're really used to picking up, again, the kids at school, we work in 150 schools. And so just the sheer logistics of right now trying to figure out which districts are fully virtual, which ones are fully in person, which ones are doing the hybrid model. And that's obviously changing all the time. And so it's been quite a lot of fun for our program staff. And so we're really just working hard to keep up with all of that, to really identify where the children are, because obviously just because a child is learning virtually doesn't mean that child's at home. That child might be with grandma, that child might be with a neighbor, that child might be in a school support system or in an after school program of some kind. So instead of picking up the children at school and taking them, that's not always an option anymore. So we're actually picking up children at home and taking them to the doctor, or picking them up at the YMCA or at their after school program and getting them connected to that care. So we really just tried to pivot as far as that traditional service to really just find the kids and find where they are. And with those screenings, again, obviously we're not going to put 100 kids in a gym and screen them for vision or something right now. So just trying to be nimble and pivot and think about how we can screen a class at a time, and partnering with other community organizations to do screenings at some of those events that we talked about earlier, like community food distributions or something like that.
Yeah, that's great. I didn't think about 100 kids in a gym. that's a little hard right now. But even a classroom at a time, if classes are coming in on different days, making sure you're getting everyone and not missing a group. And I know attendance and stuff looks funny right now too. So I can imagine what the logistics of that is looking like right now. So I guess kind of back to our school staff. And I know you guys, this worked out really nicely with Tabitha being all in person and Karina all virtual. So we're getting to see the two opposite ends of the spectrum here. But what do you think as organizations like ourselves, what's the best approach, or what are some key things or tips or tricks when approaching schools and districts, whether it's services we've been providing for a long time, or if we're a new partner and we're trying to figure that out? What do you need from organizations to make this process work right now?
Who's going to get to the mute button first? Just playing. I mean, each district has a reopening plan, and that is a living, breathing document in the district. So I would advise any kind of nonprofit or outside service delivery organization that wants to come into a school or school district to at least consult that, so they have an idea of what things are in place. Couple of reasons. One, so that you can inform your staff of what it might look like going in, so that their level of comfort, should they be able to partner with that school or that school district, is comfortable going in with the measures that they have in place. And then also so that you are knowledgeable and your conversation with the school or with the school district can be more about the service delivery and not so much the protocols that are going to be in place. So I would consult the reopening plan for the school district. And then, I think relationships are really important. So if there's anybody that you may know that may be in that school district or in that school that you can kind of connect with and find out who would be the right person to contact, because sometimes it's different from district to district and school to school. This person at this school may be over, the assistant principal maybe over special education and at this school, but in another school you have an assistant principal over it, but it's really the special education department chair that really runs the shop. So that might be the person that you start with to kind of get a foot in the door. So yeah, those are the two things that kind of come to mind for me: building those relationships, and then consulting that protocol reopening plan, so that your conversation can be more about service delivery and not about the measures that need to be put in place.
Some things I guess to add would be making sure that we're or the agency that will be assisting the students is accommodating to just the diversity. So Richland One, I just know because this is the only district I've ever worked in, but it's very diverse. And so, you know, there are families that have a greater need than some other families might have. And so being able to just be diverse in whatever services that will be offered. I think one that's very important is just asking the school maybe what they need. And so if you want to work with a specific school or a specific population, there might be some needs. You know, I come across people that offer services to our school and, or I need services for the school and I don't know who to go to. And so people that out there that have those resources, if they would just come and ask, you know, do you all need these things? And, you know, you never know, you know, what collaboration or what you can make happen. And I think also just something that kind of comes to mind is like the platform. So I know Paige mentioned like Microsoft Teams, Google Meet, and Zoom. And so our students have, you know, in Richland One, we're all like Microsoft Teams. And so just something as simple as if you're going to do some type of virtual meeting or something to that effect, and you already plan to do it in Zoom, just kind of taking into consideration that all of our students have been thoroughly educated on how to use Teams, you know, and you might miss some kids. And so being very, you know, open to, okay, well, we can probably convert what we're doing over to whatever you guys are using inside your school district. So.
To add to that, as far as and that was a really good point with the Microsoft Teams and service delivery and the different platforms that are out there, because I too struggle with this one or that one. But to add to the service, you mentioned something about the needs, and I had wrote down whenever I was thinking about today's panel, it's really, I mean, the biggest trick would be that you make sure you match the needs of the school or the community with the service that's being provided. So, you know, and I know that, it's Karina, right? Karina, okay. Said that, you know, ask them what they need. And that is certainly a way to go. But sometimes they are so, and I say they, meaning me, like we're just so in the trenches and in the forest that we know what our community needs, but sometimes it's nice for, you know, a service provider to know my community, know my data, know my information, and say, look, this is what your community is. This is what the data is. I know you know this, but this is how I can help with that particular need. And so I guess a trick would be kind of do your research. And there's so much data out there that you'll be able to find what you need to kind of bring in to have that conversation. So I like Paige earlier, she shared those statistics that everybody can relate to, which by the way, I would love to get a copy of that research. I think I just saw where you said you would send it, so thank you. But so I think, you know, matching that service to a need is critical, and knowing the needs of the community or the school district in which you want to provide services in.
Yeah, I think that's great. I know that for me, working my way into schools, that it's a lot of, especially with partners we've been working with for a long time, they know that we're flexible. And so I'm like, what can I do to help you? And so it's been a lot of plug and chug, or I've got this, or we've got this. And so it's a lot of just that open communication and making sure that our partners are feeling like partners and supported, rather than just that exchange of services and goods, which is hard right now, but it's so important. So kind of for everyone, just in thinking about what we've chatted through today, Is there anything that you have seen or that we've gleaned in the way that we've changed these services and that we're working with one another and maybe new partnerships or whatever that might be? Are there things that you might hope to see stay in place when this pandemic is over, or when things start to head back to whatever semblance of normal is or before? And are there things that have been helpful or that we've learned that you can really use in moving forward and as something to really access students more, engage students in different ways than maybe hadn't been explored before?
Yeah, I think we all have to kind of take this and think something great is going to come out of it, because that gives us hope, right? And other than being Zoom experts, I think we've all learned a lot about Zoom over the last few months. I think this is a great question because, again, just kind of reframing, thinking about all those positive things. And I know some of the things that Paige just shared about how they were able to pivot and go virtual, I'm sure she's going to touch on. And I think that's a really awesome thing that has happened. During the first few months of the pandemic for Healthy Learners, we partnered with over 45 different organizations statewide to really address community needs. And it wasn't necessarily traditionally how we serve. It was, what does that community need? So kind of going back to what Karina just shared, is what do y'all need? And so over those summer months, it was predominantly hunger. It was addressing those basic needs that we need to figure out how we can coordinate together before we can address some of those higher needs. And so I love that we got to work with so many people and so many different companies that we might not have otherwise. So but like I said before, we typically work with those school nurses and just getting referrals from them. And with so many students not in the buildings, or at least not in the buildings full time, we've had to really change how we're receiving consent forms, how we're identifying those children. So we've really gotten to expand that from just school nurses to our providers, community partners, like everybody on this call, and even directly to parents. And so I think that's been really exciting and definitely something that will continue after the pandemic is over.
And as Amanda said, I will say the virtual thing is something we're hoping to keep. Our program comes down from our NAMI National, and they have never allowed us to present virtually before. And we all pretty much have said that that horse has left the barn, and I think they'll have a hard time getting it back in. But that's opened so many doors for us, because even though we do have issues with internet access in rural counties in this state, there are still times when we're able to present to parents or maybe even school staff that distances might be difficult for us to get to them if we didn't have that virtual option now. So I'm hoping that we will be able to continue to keep that and have that as even when we go back in person, that would still be something we could do.
What about from the school side? Are there things you're seeing? And I know y'all are in such transition and things change every day, but are there things that you would like to see move forward, or things that you think might be helpful in moving forward or adapting in some way?
I think that our educational system will never be the same. And I think that it is forced, and and I don't know if this is the rabbit hole you want me to go down, Paige, but I think that it's forcing a lot of our educators to kind of think and develop and grow in different ways that they never thought that they would have to, because they're having to. I mean, I had a teacher yesterday say that I feel like this is my first year of teaching all over again, because they're having to develop, different lesson plans to meet the needs of 3 different learners that they may be teaching that one period. One might be live virtual, face-to-face, and self-paced. And so it's a different world, but the good, Amanda, so you said coming out of 2020, we would hope that something good will come of it besides, being professional at Zoom, which is super funny and witty, and I'll have to take that. But what I hope and pray and what I see come out of it is that we're going to have some awesome rock stars in our classrooms that are going to be able to differentiate like they've never been able to differentiate before. They're going to be able to scaffold like they've never been able to scaffold before. And we're really going to, I hope, get to a place where, teachers are meeting the needs of the individual students and not our middle ground. And I think we have stellar teachers out there now that are doing that. And, and I'm not speaking specifically for the school in which I work, just globally, I think that we're going to have a different educational system. And Paige, you said something too that made me think of something that I wanted to tag on to you, but I can't remember what it is. But if I do, I will chime back in. But that's where I see this pandemic heading. We're going to have an educational system that won't be the same, but I see it being good for kids.
And I guess, all that Tabitha said as well, and, just virtually our students being able to kind of like, I think the word that comes to mind is like independence. I think a lot of the thing has made a lot of our students more independent and, self-sufficient and kind of searching and fulfilling the needs of some of the areas that they could, that they might not have done prior to being put in these situations. Outside of the high school, just thinking about my own child who's in 3rd grade, and I mean, he can log in, he can whip through, and he's very computer savvy now that he might not have had those skills this young prior to now. So, just in thinking about the virtual aspect, there are some good points to some of the things that our students and families have had to deal with.
Yeah, and I've seen that with some coworkers where, even from last week to this week, there's a little head that pops up a little less now because they can log in and out now, and so I do think there's a lot of these, like, this technology is not going away, it's only ever improving, and so if youth can get it in their hands and understand it a lot earlier, it's only going to create some good and be creative and keep that process of innovation going. Therese reminded me in the last panel with our youth last week, they made it extremely clear that Facebook was not for the youth, and it's only for old people. And thinking through, and I'm sure schools, you're communicating with parents more so than directly with youth, but what platforms are you guys using to support or to connect with youth, or make sure that they're getting the information that they need, or opportunities to connect with services or to get support with their teachers in school? What do some of those things look like?
Primarily, we use email, we do use Facebook, we have what we call Remind. So it's an application that is utilized in our secondary schools, and in our elementary schools, it's Class Dojo. But it's just a more intuitive, kind of text-friendly platform that teachers and students can utilize to communicate between home and school. So those are our main avenues for communicating with school. And then we have a call out, which I know that probably almost all schools and school districts have, but we have a call out that can turn into an email. And if you're a parent out there that has a child in the system, you probably get those emails and those calls. So, so that's a way that we get the message out as well.
And we use a lot of those same platforms. I know, kind of embarrassing, but a lot of our students, when we first went virtual, were not getting any messages, and they were all receiving tons of emails. And so they were like, well, how do we even get in there? And they weren't checking their email. They didn't, it just wasn't it's just not, you text. And so they don't use email. And so, just simple things like that, now they know that their main communication through the school is going to be email. So all of them are checking email. Oh, just send it to my email, Ms. Jones. And, and so it's just different to hear them say those type of things now, and look at 6 months ago, they were like, how do you even get in the email? and so it's very good, just to see their progress in those areas. We use Facebook, we use Instagram, and we have a Twitter, so we can put a lot of our information out to our kids through those platforms as well. And through Microsoft Teams, it's been very helpful in creating different channels and just all kind of stuff that I had never used before. And you can send massive emails where I can copy, if all the kids are in this team, then I can copy the email address and it'll send it to the entire school. And so just different things like that have been very helpful to make contact with all of our students.
That's what I was going to say
I think
too.
for us,
I'm sorry. Go ahead, Amanda.
For us, we don't typically connect and communicate directly with the students. It's really, again, with the parents, with the school nurses. But I do think we've pivoted a lot during this time because, again, same thing. What's the easiest way that people like to communicate? How do we make that the easiest? So, we did in the past a lot of paper, these consent forms that these nurses were getting, which totally worked when these kids were all in school, but we've moved to a completely online consent form and developed QR codes that these parents can just scan and quickly fill it out, that is just accessible to everyone. And so I think it's, like you said, just being able to adapt. A lot of our families that we serve are low income. And so in many cases, a phone call might not work, but even if minutes are up on a cell phone, we'll find that parents can still use text messaging, and that's how they like to communicate. And so we've just tried to adapt and do a lot of that. But something else that Tabitha said was just opportunities for that collaboration piece between these services and how the schools are communicating, I think, is an opportunity. So even as Tabitha just said that, I was like, oh, we could send out the consent form link on Remind or through Class Dojo to some of these schools, right? So I think it's partnering with the community organizations and the schools and figuring out what works best with the parents and how can we work together, again, to get the information about the services to them. So maybe an opportunity there.
And I have a couple of young staff members as well as some of our young adult speakers who informed me that Facebook is for old people. So we do have Facebook pages we've developed for the one for parents and one for teachers. So we just use that to focus on, getting articles and self-care and tips out to the adults. And then we've created Instagram and Twitter. We haven't gotten into TikTok, but just trying to figure out how do we connect directly with the youth, which can be challenging. Some of our young adult speakers, when you said they don't use email, I'm like, yep, that's true. So we have a couple of them. I'm like, did you text them? They're like, no. And I'm like, well, they don't check their emails, so text them. So that's an ongoing challenge, though, is to try to figure out how do we connect directly with the youth if we're not able to, get into the classroom, whether it's virtually or in person. And so that would be something that we would love to explore more because, getting them, those resources. We've done a lot of different things this summer, but I feel like a lot of the things we've done have probably been geared more towards the adults, and finding ways to connect directly to the youth would be really helpful.
Yeah, we have not ventured into TikTok. We've got Instagram and Twitter and Facebook, and we've tried some of those other things. GroupMe seems to be a good in between. It feels like texting, very similar. It's an app, and then I have really relied on Google Voice and giving youth that phone number, and it's an app, and I can use it on my phone, but I can also turn it off and not get notifications. And then a youth doesn't have my personal phone number. So that's been like a nice in between, and that's free. So that's been a good resource for that texting. It's not for a mass group, but at least for some of the youth I work one-on-one with, that's been incredibly helpful.
What is it, Paige? What is the one that you said right before Google Voice?
GroupMe, GROUP me. Yep. And that's very similar to like WhatsApp, or it's essentially like a bunch of group. Sorry, that's my dog. She sees a squirrel. And then Tremise also reminded me for some of our organizations, funding is a big piece of this, and grants, and some of that involves partnerships. But have you guys felt pressure from your funders during this time, and what's that look like, or meeting those goals, or whatever pressure might appear to you as? Has that affected your service provision in any way?
For us, yes and no. We've only had one grant that we weren't able to keep, and that was because they had funding issues. So they financially couldn't fulfill their grant. Other than that, we haven't lost any. We have one that comes through, it's the Department of Ed, but it's SAMHSA funds it. And SAMHSA has probably been less understanding as far as numbers go. So, they wanted to know how we were going to make up our numbers when everything got done with the pandemic. And obviously at that point, they were thinking short term rather than, this is going to go on for a while. But I would say our funders have been really gracious and understanding. But one of the things that we've really tried to do in the midst of not being able to do our presentation, which that's what our outcomes are based on, is the actual presentation. We have done so much over the course since March of trying to, we have posters we just send out with all kinds of resources to the schools. We've had postcards that have gone out that have parent and student information. We have just tried to get resources out in any way we could through, we've done some through food banks, we've done some through pediatricians' offices, United Ways and other organizations. So that's one of the ways that we've tried to keep our funders happy too, is to say, we can't do our program right now, but we still are getting that information out. And so that's kind of been our experience so far. But yeah, it's definitely a worry to make sure that we can keep them, happy despite not having the numbers that we normally would.
Yeah, and I would echo that. I think I would say yes and no. We have had gracious funders, of course, that, we're just trying to communicate. And we've had some grants for screenings, for example, where it's like, we're not going to be able to screen kids in the way that we were, but this is kind of how we're pivoting, and this is the best way that we can do it. So just trying to work with the funders through those. I think we've had to, like a lot of nonprofits, we have events and fundraisers to also raise money, and not being able to have those events in person and having to switch things around and cancel events has been a huge obviously burden on us. So we're doing our best to really pivot and have a lot of virtual events this year to kind of help close that funding gap. And then just again, to echo what Paige said, those numbers are not going to look the same next year. So just looking at the data and being able to, we canceled hundreds of students' medical appointments at the end of last school year. We're certainly having lower numbers right now, trying to identify the kids and then having to transport less at a time right now. So really just looking at those trends and being able to say this is where we were on pace pre-COVID, and just really being flexible and being, I think, realistic about the situation we're in right now, and just kind of keeping to track that data. But we've been pretty gracious, had some pretty gracious funders, of course. So.
Yeah, I would echo that's very, very similar experience for us as well. And some that have really stepped in and supported way more than we thought in our time of need. And so that's been, it's been really interesting to watch that play out. And it's this new grant season and kind of how we have to adjust and goals look different. And so Tabitha, I guess, how does that translate for you in the school setting? Is do you feel like, my mind goes to PTAs and funder, like donations that you're getting from parents and the community? Do you feel like some of that has lessened, or that's going to impact your school long term on some things that you might have relied on before that don't seem as reliable right now?
I don't know. That's a really good question. And I don't have any data to support like what I think and what I don't think, except for my experience as a parent and as an educator in the school system. I anticipate that it will probably affect like those fundraisers. I do feel that our face-to-face students get more direct communication. You know, the flyers can come home with the students in their hands and is given to the parents, or the parents get it that way. But if my child is virtual, then I'm probably just getting an email. I'm not getting something mailed home to me. So I think that I would anticipate that it probably will have an effect. What I was kind of wrapping my brain around is, you know, what kind of funding did we get because of COVID? Because I know that we did get, you know, there was some CARES Act money that was provided, and for our elementary, and I'm speaking for, I do believe this was for the state, and Karina could probably attest, like if it was also in her district, but I'm pretty sure it was for the state, that all, K-8 schools received additional funding to pay educators to come in and do testing before their school started back, and they called it Leap Week, which was a way to kind of get an idea of students' present levels in regards to their reading, their written expression, and their math skills. And then, but there wasn't any provided at the secondary. They really were just focusing on that K-8. So I know there was some additional funding there. And I know that we received some additional funding for PPE and some funding to put towards sanitation practices and materials. But yeah, the question you raised, Paige, that's a really good one. How will it? Because I know we've got schools that bank on that, you know, that really like budget out for this fundraiser, we're spending it on this, or this fundraiser, we're spending it on that. So it'd be interesting to see how things play out and how they need to look at supplementing those funds or pulling from somewhere else. Good question.
Thank you. And Karina, I know you had gotten kicked off and you're back on, but I had posed a question. We were talking about funding, and from the nonprofit side, it's, you know, pressures we're getting from our funders, or if we're not getting as many grants, or what that might look like. And I posed, are there some funding streams, and PTA is one that comes to mind for me, or, you know, regular donors that maybe within your school that's not really an option anymore, or are you noticing that it might have been relied on before, and it's adjusting or changing in ways that you hadn't really thought of yet?
And my internet is acting up a little bit, so hopefully you all can hear me. I switched phones, so but I guess some things, and I don't work so much when it comes to academic wise of knowing too much about certain funding things, but in terms of like donations and people that would fund like incentive programs, and we would get a lot of, that was kind of like my area to go find people that would sponsor different programs and bring in donations and incentives for our students. And so individuals and some of the companies that had been doing some of those things might not have it in their budget now, just financially, because of the economy of what's going on. They might not have it to be able to provide that amount of donations. I know I had a partnership with some organizations that would provide different type of food and stuff like that I can go pick up extras and stuff, and so that I could distribute. And so we've lost several of those type of donators, as well as I mentioned our snack pack program. We had a partnership with a certain agency, and I think that one of the coordinators ended up passing, and so that affected our relationship with them and us being able to provide our snack pack programs. And then one other thing is I'm also the junior class advisor, and so I am over prom and pageant. And so both of those activities are primarily fundraising. And so I'm starting this, just getting my class officers together and things virtually, trying to figure out how can we bring money in, so that, all the students last year lost their prom, and that's a very big event, and it's very important to kids, especially when you're in high school, your senior year. And so those juniors are like banking on Ms. Jones, you got to figure out how we're going to have a prom this year. And, so just trying to figure out how to do those type of things, it's affected different areas of our programming.
Great, thank y'all. I know we're 4 after 4 here, so our time is up, but I appreciate everyone's time here, both in panelists and attendees, and And I hope that there was some information gained. I know I have got a few notes for myself and some new ideas and thoughts. But this has been recorded, so it will be shared out with everyone and posted on websites for future reference. But I am always available to contact, and I know our panelists are as well. And I just want to say thank you for Tramise for putting this together, and for Family Connection for providing all the tech and the support and making this happen. And thank you all for your time and your energy. And I hope that you go into your evening a little bit more relaxed, and hopefully we will see each other soon to work together soon. So thank you all so much. Have a wonderful evening.
Thank you.
Thank you for having me.